Welcome, I'm Dr. Doris today. I'm a board-certified dermatologist here in New York City, and I'm here with Corina Crysler, who is a registered nutritionist. We're going to talk about a new category of foods. Well, it's not so new, but it's new in the sense that there's great new products and new science involved in a functional category called nutraceuticals or nutracosmetics. So Corina, tell us a little bit about what this category is and what it means to take a supplement that's a nutracosmetic.
So basically, a nutracosmetic is an ingestible skincare product. So it's been made specifically formulated to, have benefits for the skin and the body. A nutraceutical is the active compound you would find in a food or a plant. So the nutraceutical of a tomato would be lycopene. So the best, in my opinion, the best nutraceuticals that you can use in a nutracosmetic would be those that have a specific mechanism of action for the skin.
One of the issues I have is doing a test to determine exactly how something you eat directly affects your skin.
Yeah.
Because there's so many variables. So how do you know if a product has proper science, if those ingredients are stable from batch to batch? Because with a drug, there's testing, right? You have to go through the FDA, there's specific tests you have to do. But when you go to the drugstore, the health food store, and you try to buy something, there's an overwhelming number of products and ingredients. And I worry about preservatives, other ingredients, and consistency from one bottle or one pill to the next.
Well, the easy answer to that is to talk to your dermatologist about what is best to take, what is the best brand and what is the best thing to take for your skin. There are several companies, mine included, that does a lot of clinical research and works with physicians to show the efficacy of the product, and if products are used with treatments as well. They definitely don't replace anything that you're doing, topical treatments, anything like that.
Well, that's what we call them, supplements. They're meant to supplement an overall healthy diet and healthy skincare regimen, along with in-office treatments and creams and products as needed.
Absolutely. Nutraceuticals and nutracosmetics go directly from the inside out. So it is a way of targeting the dermis at the lower level, and that's essentially why they take a little bit longer to work. You have to be patient with them because you have to go through a couple skin cycles. So patience is definitely one of those things that you need to have when you're using a nutraceutical. But yeah, look at the clinical data, make sure that there's standardized extracts on the labels instead of just one word without no standardization. So our standardization is the only way that we can actively show that that specific thing is in the label. And in Canada, we do significant research and studies, and we have to prove to Health Canada what's in our products.
Even as a nutracosmetic?
Absolutely, yeah. It has to be approved by Health Canada before we
test it.
Yeah.
So the dermis is the deeper layers of the skin, and I am a big fan of beauty from the inside and out. So I've been advocating for many years having a healthy diet, knowing what you're eating, what you're putting in your body, and using supplements and nutracosmetics along with the treatments that I do. And I have to say, when I first met you and I saw these products, I was very skeptical because I'm naturally a skeptic. As a scientist, as a researcher, as a doctor, my job is to be skeptical and have you really prove to me. And I was so convinced. I carry your products in my office, and I'm very proud that I do, and my patients love them and they come back. So tell me a little bit more about the products that you have in your line and why you came up with the ones that you did and how they're used.
So when we formulated our line GliSODin Skin Nutrients, we have an amazing main ingredient, GliSODin, which essentially targets inflammation. So when you're working with the skin and you're taking something internal, you have to be very specific how you're formulated. Vitamins or minerals really don't get to the skin. They're usually metabolized or not quite bioactive in the body. So that's why we looked for all natural, highly regulated nutraceuticals that have a very specific mechanism of action. So the basis of our entire line is it acts as a natural anti-inflammatory. It raises your primary antioxidants within your own body to fight free radicals. Because we always talk about these free radicals, but essentially what they do is they are the precursor to causing inflammation in the body and the whole entire aging process. So if you can kind of start at the root problem, then a lot of issues with the skin go away, as you're very familiar with. So that's the basis of the line, and then we just looked at the main categories that the cosmetic industry has to face with, like pigmentation, acne, detoxing, body contouring, and all those sort of areas. So we targeted our products specifically for those types of treatments.
You have some interesting data on pigmentation, on brightening, along with in-office treatments. And tell us a little bit about the studies that you did and how you came up with those before and afters, because they're pretty impressive.
Yeah, we worked with Dr. Julie Kaufman and Frederick Brandt on our main skin brightening formula.
Very highly reputable dermatologist.
Yeah.
And unfortunately, Dr. Brandt has passed, but Julie Kaufman is doing great and is a great dermatologist. I've had her on my radio show. I always love talking with her.
Yeah,
so.
she's amazing. Yeah. So what they did is to standardize that type of treatment, we used the Fraxel laser, and we looked at treating the patients before the procedure and then testing them 3 months after with using this product. And basically what a nutraceutical will do for pigmentation is it helps heal and repair, but it doesn't act like a block where some block will actually blocks the UV rays. What it does is it increases your ability to fight the damage from going to inflammation. So essentially what our skin brightening formula does is it helps your body fight the UV damage.
So I know Dr. Kaufman's in Florida, where Dr. Brandt was as well. So in an area where it's always sunny, you can sort of measure that.
Yeah.
Is this something that works even if you don't do it with a laser treatment on its own, or is it meant to be with a device?
You can take it on its own. When you do it with a device, you're obviously going to have an accelerated result because doing the two together helps the results for sure. But you can take it on your own. It just will take a bit longer for it to actually work.
So what are the other ingredients in the product?
We use usually for our two face products, we usually use an oil that helps with hydration. So the skin brightening has borage oil, and our anti-aging formula has krill oil. And krill is an awesome fish oil. It's not quite a fish oil, it's more of a crustacean, but its phospholipid content is far greater, so the actual omega-3 gets into the cell, whereas you'd have to take a lot of other fish oils to get that much active compound in it.
And how do you assure quality from one pill or bottle to the next, from one batch to the next, over time, and stability for the long term?
Sure, so we've done stability tests on all of our products, and we use standardized ingredients. So we've used reputable companies from either North America or Europe that test all of their ingredients, and then when we bring them to the US for them to be made, they're tested again, and then after the product is made, it's tested again. So there's 3 levels of testing to ensure that the efficacy of the product is actually.
So I've been very happy with your products, and I carry them in the office, and patients are happy and they stay on them for a long period of time. I also use other nutracosmetics. I use one for the hair called Nutrafol, which is a combination of products, and another one called Resveratrol, which is resveratrol with sirtuins. And I find that when I combine for the patient the right mix of supplements along with proper skincare, in-office treatments is appropriate, and of course proper sun protection. That's the most important thing you do. We talk about getting enough sleep and having a healthy diet along with this. And right now we're in harvest season, so we have pomegranate and pumpkin and all these great foods that are available. How do you tell people how to combine these with other supplements they may be taking?
Yeah, it really depends on what you're trying to achieve. So especially with something like hair, it can be a multiple of issues of why you're having hair loss, or what, so you have to make sure that you're taking the right type of supplement to target those issues.
Is there any conflict in terms of taking them together with other supplements?
Not usually.
Or with or without food?
Not usually a conflict. Sometimes it can be overkill. Like we have a lot of people that ask, can I take the brightening with our anti-aging formula? And I just say it's just too much. It's not needed.
That's true. I get that too. So I will select out between brightening and anti-aging depending on what the major concern is. So some people really have melasma. They have a lot of issues that way. And I might use it with oral tranexamic acid to help enhance that brightening. And that's a prescription product that we use sometimes for melasma patients, and we get great results with it. And so I'm happy to have a nutracosmetic along with prescription products. But in terms of, and I agree, and then sometimes it's really more the anti-aging side, so I'll pick that product. And I like that it's not too many pills in the day, and people tolerate it really well. So it's 3 pills a day of the one that you take, and you can take them all at once.
For compliance to actually happen, you have to make things simple for people, because you know, we all are busy and we don't want to like worry about it. Has to be easy, and that's a huge issue with nutraceuticals. You have to keep things easy for your patients.
So it's okay to take them all at once in terms of blood levels and maintaining it that way, or is it better to take more than once in a day?
As long as you're getting the active therapeutic dose per day, it doesn't really matter.
Oh, good.
So it just depends if someone has sensitivity to taking pills, which a lot of people do, especially like fish oils and stuff. You can combine it with food. If
Isn't it better with food?
Not
fish oil? No?
Not necessarily. Fat is a great carrier to actually help with bioavailability, which is why a lot of our pills are in a fat base.
That's why I thought if you take it with food, because usually it has some fat.
Usually,
well, at least maybe that's my
it can, but it doesn't have to. It just depends on the individual. But we usually recommend people to take with food, so there's no issues.
Perfect.
Yeah.
Perfect. Yeah. Well, this is good. So if you're interested, you can learn more at GliSODin.com or going to my website, which is myclearskin.com.